As of Wednesday, March 25th, there are 3 additional cases of coronavirus in Oneida County. Now there are 15 people that have been tested positive, but the director of the Oneida County Department of Health, Phyllis Ellis, tells us that many of the people who tested positive for this virus just last week are already beginning to recover. Oneida County Executive Anthony Picenti will hold a daily briefing Thursday afternoon at 3 p.m. That will be streaming live right on our website, CNY homepage, and updates on that can be found on our stations WUTR and WFXV. During Thursday's daily briefing with Governor Cuomo, he said that the goal is to reduce the rate of increase in cases, not the number of cases, and ultimately avoid ever reaching an apex. The state is now scouting for sites that could be used to house patients in places like the Javits Center, Stony Brook, Westchester, and Westbury. The goal is to have at least one 1,000-plus overflow facility in either one of the 5 boroughs in New York City, Nassau, Suffolk, or Westchester, or Rockland. So in one of those locations, they're hoping to have that 1,000-plus overflow facility just in case that's needed for extra patients. And according to the governor's office, the average time for a COVID-19 patient on a ventilator is 11 to 21 days. Now they are continuing to shop for even more ventilators. 7,000 were purchased as of Wednesday, March 25th. There now is a splitting technology that has been approved so that 2 people are able to use 1 ventilator at a time, and some anesthesia machines will be converted for ventilator use as well. Patients being treated for coronavirus downstate will be sent to upstate hospitals, and this will help minimize the amount of people in an area and hopefully slow down the spread of the virus. This plan also includes expanding hospital capacity for both central and upstate New York hospitals. The economy has already lost somewhere between $10 billion and $15 billion due to the pandemic. A $2 trillion stimulus will be sent to individuals and their families, small businesses, and to unemployment insurance. But the governor's office is saying that this doesn't adequately address the government loss. New York State has received $5 billion, but that's strictly to cover COVID-19 expenses. As of Thursday, there are 52,000 medical staff who have stepped up to volunteer to help treat COVID-19 patients. That's a 12,000 person increase just from yesterday's report on Wednesday, March 25th. There are also more than 8,600 mental health professionals that are preparing to help volunteer as well. There are now approximately 37,258 cases across New York State and 385 deaths. More updates on COVID-19 can be found daily on our stations WUTR and WFXV and always online at cnyhomepage.com.